Hi, everybody. I wanted to talk about a topic that maybe you have heard of and maybe you haven't. It's called developmental dysplasia of the hip, DDH, or congenital hip dysplasia. It goes by a few different names. This is what we look for in our babies, and we examine our newborns and infants every time we see them, from the time that they're born all the way till the time that they're walking normally. We're checking for normal feeling hips. There are risk factors for the development of hip dysplasia, and those risk factors are a little bit different depending on which guidelines you're looking at, but in general, we agree, the different AAP and orthopedics and everybody agrees that breech presentation puts babies at risk for developmental hip dysplasia, and family history. If there are other relatives in the family, first degree relatives, so grandparent or parent, sibling, then that puts the baby at risk for hip dysplasia. And improper swaddling. So if you are swaddling your baby with their legs, so pretend my arms are the legs. If you're swaddling your baby's legs like this, instead of allowing some breathing room, then that also puts your baby at risk for hip dysplasia. We want the babies, if this is the hip, we want their hip to be able to move, the femur within the hip. It's very important that you look up some videos on how to properly swaddle your baby and let their femur hip bone be able to move properly. When we see the babies in the hospital, we're going to do some movements to make sure we feel solid hips, that there's no movement of that femur in the hip bone. If there are pre-existing conditions such as family history or breech presentation, we are going to ultrasound your baby either at the time that we feel an abnormality on exam or at the 4 to 6 week time period after birth to make sure that hip, that the femur is enclosed properly by the pelvis. We want to make sure that it's nice and in the hip just as it should be and not in an improper position. If for some reason we are feeling that the hip is not quite stable and that ultrasound shows that there's not quite the stability we would like, we'll send you to the orthopedist, and the baby might end up in something we call a Pavlik harness. It kind of sets their hips up in a frog leg position, and they'll stay in the Pavlik harness for several weeks and get re-ultrasounded to make sure that that union is looking really nice and tight. Decades ago, before this was caught, many people were actually having terrible limps and pain in their hips because hip dysplasia was not looked at, talked about, and sort of prevented by ultrasounding at early age. You can also x-ray the hips around 9 months to make sure that we're continuing to follow it and not missing it. It is more common in females than it is in males. Not to say that boys can't have hip dysplasia, it's just more common in females. If your pediatrician asks you if there was any breech presentation during your pregnancy, or if there's anybody in the family with any hip problems, and we don't just mean arthritis of the hip, but we mean dysplasia of the hip, then you might be asked to have an ultrasound. Ultrasounds are not painful. The baby isn't going to hurt. It's the same kind of equipment they use when you're pregnant, right? So they're going to put some jelly on the baby's hip and look there, and they'll look on both sides because obviously dysplasia can happen on one side or both sides. That's sort of just a simple guideline of what DDH or congenital hip dysplasia is and what we're looking for.